We have a special guest with us in the studio, Professor Peter Psaltis, who is a cardiologist and a researcher whose primary focus is preventing and treating atherosclerosis. Now, that's a bit of a tongue twister.
It's a bit of a mouthful, isn't it?
For early in the morning, but it is a really important area of research. Good morning to you, Peter. How are you?
Good morning, Kate. Good morning, Tom. Thanks for having me.
You have to tell us first off, what exactly is atherosclerosis?
Well, you've done
well
twice there, Kate. So let's break the word down. Atherosclerosis comes from the Greek, athero, gruel, porridge-like, sclerosis, hardening. So this is the disease where we get hardening and narrowing of the arteries in the body from the build-up of fatty, cholesterol-rich inflamed plaques. Now, those plaques can build and grow over time. They restrict blood flow to organs. Where they become really dangerous is if they suddenly crack or rupture. You get a piece of clot blocking the artery over the plaque, and that's when you get tissue damage. So this is the major cause of heart attacks, causes many strokes. When you hear about people having circulatory problems of the lower legs, that's atherosclerosis. And increasingly, it's very closely linked to dementia. So atherosclerosis of the small blood vessels of the brain, but also the risk factors, the things that cause atherosclerosis are increasingly connected to Alzheimer's disease as well. So all those conditions I've just talked about, they are the individual leading causes of death in Australia and around the world. Heart attack, dementia, stroke. And in the time we have today, one person in this country is going to have a heart attack, possibly lethal. 60,000 Aussies every year, about 10 million people a year have heart attacks. So our work at SAHMRI, at the Royal Adelaide also where I work, and the Queen Elizabeth Adelaide University is all about preventing, treating, predicting when this disease is going to run riot.
Absolutely. So who really gets affected by atherosclerosis?
Everyone's vulnerable, Kate. It's just so common. So men and women, that's the first thing we have to understand. This is not just a men's disease. The average age of a heart attack in this country is 62. What does that mean? That means that it's young, but it also means that there are a lot of people who have heart attacks under 62. So people in their 30s, 40s, 50s. I was on ward service at the RA just the other week, and a 27-year-old with a heart attack, for example. So we know that atherosclerosis starts in many people's arteries in their 20s or 30s. There are 5 major risk factors. The big 5, genetics. So if mum or dad, brothers or sisters have had a heart attack or stroke before the age of 65, that puts you at a significant risk. Then we talk about the modifiable risk factors, the risk factors we can do something about. So high cholesterol, high blood pressure, diabetes, smoking or vaping. Vaping is just as bad, really. And then there are the factors that feed into that. So things that should be fairly obvious to people. So obesity and overweight, sedentary lifestyle, stress, poor sleep, inflammatory conditions. So people who've got very inflammatory arthritis are at risk. So that's kind of the A to F. They're the things we know about as causing it. Where research comes in is there's a G to Z to discover what else is associated with it. And about 10 to 15% of people who will have heart attacks or strokes, we won't be able to identify a clear reason. And that's why research is so important, to uncover those other mechanisms.
Well, that was exactly what I was going to ask. What is the focus of the research you're doing at SAHMRI to, I guess, try and uncover more details on this killer to help people?
So, Tom, we run a what we'd call a bench-to-bedside whole-of-pipeline program. So at one end, we're all about discovery and mechanism, finding completely new things that others haven't thought about. The other end, we're about bringing treatments to the patient, to the bedside, and that's sometimes doing better with the treatments we've got, but also coming up with new therapies. So an example of the work we do is focusing on this thing called inflammation, which is what's happening inside of the plaque, trying to understand ways of measuring inflammation better, for example, in the bloodstream, but also targeting. So a colleague, Professor Christine Bursell, Chris works with something called nanoparticles. As the name would suggest, these are submicroscopic particles. They're formulated in a way that they actually find their way into the plaque. Very clever little things. And then they can target the inflammation and the fat or the lipid in plaque to provide a treatment. My particular group, different things. We've discovered a very interesting type of stem cell. Stem cell is a feeder cell inside of the wall of arteries that we've shown has caused plaque to form through inflammation and fat deposition. We also find it in other parts of the body, for example, in the skin or the muscle, where it seems to be very important for regeneration. We've taken an ancient drug called colchicine people out there listening, anyone who's had gout might have tried a medicine called Len-gout, which we often use to treat flares of gout. Colchicine's this ancient anti-inflammatory. It's been around for 2,500 years. My ancestors, the Greeks, used it 2,500 years ago. We've been studying how colchicine can be repurposed or reused to block the inflammation, atherosclerosis. And the last little bit of work that I'll describe is we're doing some really cool work in the area of imaging. So we like to see what we're treating, and there are some very cool tools that allow us to look inside the body at plaque to see what it does. And at SAHMRI, at Jones Radiology, at the base of SAHMRI, we've got a world-class CT scanner called a photon-counting CT scanner. Thanks to the state government, the first one in the Southern Hemisphere when it was brought in 3 years ago. And this CT scanner's got very high resolution, lower radiation, so it's safer. And we're doing several studies where we're actually tracking over time how plaque changes. So we can understand why some people have progressive atherosclerosis that grows despite treatment, whereas other people get a really good response to treatment, trying to uncover those individual differences between people so we can personalise the way that we treat their disease.
It's incredible work that you are doing, and especially in the area of inflammation, because we know it's a huge issue. It's a big buzzword in the wellness and health space at the moment because of that sedentary lifestyle that we lead, because of the kind of foods that we're eating, because of the levels of stress that we're living under. So it is and has the potential to affect such a large percentage of the population going forward. When can people start to benefit from this research, Dr. Psaltis, and how can they help?
Yeah, so first of all, the path to research is a long path. A lot of the treatments that people take for granted now have taken decades to get to clinical practice. So some of the things I've described today, nanoparticles, stem cells, they're what we call the bench side of research. They're still being worked up. Some of the other treatments, the imaging that I described, the work with the drug colchicine, they are being, they're clinical trials. We're doing those studies in people at the hospitals around the state. So first of all, we want people out there to know about heart health. Talk to your doctors about your heart health, get a heart health check, know your risk factors. We want prevention. So that's very important. From a research perspective, the research we do does cost money. Getting competitive grants in Australia through the Heart Foundation, the NHMRC, success rates cater about 8%, 8 in 100. So we do rely on generous donations from the community. We're very grateful when they come in. They really help fire up our work, get it towards the clinic. So anyone who's interested out there, feels passionate about this, we would welcome, first of all, your interest, but any opportunities, to receive donations, always very welcome. You can visit SAHMRI's website at sahmri.org.au to find out more.
Well, Professor, you do, as Kate said, amazing work. Thank you so much for coming in today and continue your great work. It's so important, and we appreciate your time this morning.
Appreciate it, Tom. Thanks, Kate.
Thanks so much.
Professor Peter Psaltis there joining us here on FIVEaa Breakfast.